region. Be overwhelming and difficult to understand. So our solution to that problem is the HCI Platform, a web-based information system. Oops. Is everyone hearing me?
Yeah, we can hear you perfectly.
Okay, I just saw a chat that there was miscommunication. Okay, our solution to that problem is the HCI Platform, a web-based information system that takes data from various publicly available data sources and creates local dashboards of health data that are more visually appealing and easier to understand. In addition to the data, we also provide context so you can understand how your community is doing compared to other communities in your state or in the country. We provide a database of promising practices, opportunities for you to highlight the current work that you're doing, and ways to track your progress over time. And the ultimate goal in providing your organization and community with this data is to empower you to take informed action towards improving the health and well-being of your community. So this is a slide of where HCI works. We have a presence in 38 states, and it says we have over 100 million lives covered. So I think this number has increased exponentially since the slide has been created. Features and tools. We have many tools available on the Healthy Williamson site. There's a community dashboard, which is a data dashboard that houses all of the indicators on your site. You can search and filter by geography, topic, and subpopulation groups, such as race and ethnicity, age, and gender, when available. We have customizable dashboards that include 170 health and quality of life indicators as available from public, online, state, or national data sources, and dependent upon statistical validity or a geography. Here, the Healthy Williamson team has created customized dashboards featuring the aging population, children, social and physical determinants of health, hospitalization data, and indicators related to their shift. We also include demographic data from Williamson Claritas. Other features available on the Healthy Williamson site include the Socio Needs Index. This is a measure of socioeconomic needs correlated with preventable hospitalizations and poor health outcomes. Zip codes within Williamson County are given an index value based on a national distribution and then mapped relative to your area to show degrees of socioeconomic need within your community. We include a data scoring tool in which you can rank indicators on the HCI community dashboard according to a systematic summary comparison, grouping indicators into topic areas for a higher level ranking of community health needs. Reports are downloaded from the administrative system at the county level. We also include GIS maps in which you can quickly visualize health and quality of life indicators within your community. GIS maps display indicators available for standard geographies, such as counties, zip codes, and census tracts. We also provide data extracts in which the local administrator can have tools to download the indicators into an Excel spreadsheet for import into other applications. The HCI system comes with a Healthy People 2020 tracker. This is an HCI-maintained progress tracker for key Healthy People 2020 targets. We also include local progress trackers. This allows the local administrator to create a curated list of indicators to quickly identify and track progress on local initiatives. We also have the ability to add locally added targets. You can add local targets to HCI maintained and locally maintained indicators using the self-service tool. Other resources on the site include a Promising Practices Library. This is a database of 2,200 health and quality of life programs and policies from across the country classified by effectiveness. In our resource library, you can find a central repository for local resources, including reports, community health assessments, community profiles, and other local content. We also have funding opportunities, which is an HCI-maintained collection of national grants and funding opportunities, and the Report Assistant tool, in which you can quickly create content summary reports that can be exported and shared with others. These reports can be emailed or saved as a PDF. Indicators and data. In addition to health and quality of life indicators, the Healthy Williamson site also includes 250 demographic elements viewable at the county and zip code level. This includes population, housing, economic, education, transportation, and occupation data. The data is provided by Nielsen, and estimates are based on the U.S. Census and American Community Survey data. The Nielsen methodology document can be provided upon request. Core indicators. Health and quality of life indicators are selected by HCI and used to construct your community dashboard. Selection criteria includes data that is publicly available from state or national sources, data that is reported at the county level, and sometimes region or census tract level. We monitor the validity of data and data source. We look for the appropriate methodology, adequate sample size, etc. The high likelihood that the indicator will be replicated in the future. The consistency of data available across counties, and whether it aligns with national goals for health improvement, such as the Healthy People 2020 objective. The data on the Healthy Williamson site comes from 23 different sources. And there they are. The system supports an unlimited number of locally added indicators as well. For example, you can see that the last data source in the list was the Williamson County and City's Health District. And this team is experts in adding in local data. To add in local data, it takes up to 2 to 4 hours per indicator at first, but lessens over time. Local data that we could add could include indicators related to strategic plans, local surveys, process indicators, or national data not on the core list. Multiple comparisons are often available for each indicator. Here, for adults with health insurance in Williamson County, we have a value of 88.6% compared to a distribution of U.S. counties. This value hovers between the green and the yellow. If you hover over the gauge on the site, it will tell you the cutoff value. And we can also see that the Williamson County value is doing better than the Texas state value of 76.7%. The county value is also better than the U.S. state value of 86.9%. The prior value is a green upwards triangle, meaning that the value has improved since the last measurement period, which is 85.6%. The trend is a green box with an arrow, meaning that the last 4 measurement periods have been trending up, which is good in this case. And finally, this indicator value does not meet the Healthy People 2020 target of 100% of covering all adults with health insurance. So I know this can be a little overwhelming, but we also have a legend that pops in and pops out and follows you around as you navigate the site.
that's provided on our website and kind of understand the background knowledge that CARE gave you, and then look at the application as we can use it moving forward to make our county more healthy. So I'm going to turn it over to Melissa and let her drive for a while.
Good afternoon, everyone. Yeah, like I said, I'm Melissa Tung, and I'm an analyst here at the Health District. I'm also the lead for the Community Health Improvement Plan, as well as I do a lot of the updating on the healthywilliamsoncounty.org website. And as Ray mentioned, if you would like to follow with us, we'll be going over the PowerPoint slides. But you can go type in healthywilliamsoncounty.org into your browser and follow along with us. And just our goal is that for this website will become a one-stop shop for all our health data needs in Williamson County, as well as data on the Local Wellness Alliance, the county's community health improvement efforts, and that you can really use this resource and share this resource with your nonprofit organization, your university, or whatnot, that this will be a great resource for the county. So if you log in and if you type in healthywilliamsoncounty.org, this will be the website that you will land on, and this is the main splash page. And I'll be briefly talking about mainly the toolbar and what specific features we have on this website. And so I'll be going through step by step through each of the tabs, and we'll refer to this as the toolbar. And then also just, this is our rotating banner, and so every 10 seconds it rotates, and you can click on information concerning the community health assessment, the Local Wellness Alliance, our Fight the Bite campaign, and as well as the community calendar. And so, as well, also this month, as anyone y'all know, it's the National Diabetes Month, and so we wanted to showcase some of our diabetes indicators. As you can see, compared to other counties, Williamson County does pretty well for diabetes. We're in the green section compared to the other counties in the state. Okay, so let's get started. So if you hover over this first tab, the Local Wellness Alliance tab, it will drop down, and we're going to go through the first link, which is the Join Us section. And so for this page, we wanted to show you that it's really easy for anyone, whether a community organization or a community member or even a parent, a stakeholder, to join the Local Wellness Alliance. If you click the big blue Join Us button or the Join Our Mailing List link, it'll pull up our MailChimp sign-up form, and you can choose what working groups or community groups information you want to receive. If you want to get, you can just sign up and you can get the newsletter, our webinar information, etc. And so this is a good resource for anyone that wants to join the Alliance. So going back to the main website, if you hover over the Alliance page again, and second link, Strength in Numbers, this is just an image of our coalition model that probably many of y'all are familiar with. And we just recommend that everyone just take some time to review our model, see how you and your organization can fit into whether or not you can fit into one of the Alliance working groups, or you can take part in tackling one of our 5 health priorities. Okay, and going back to the main website, once again, if you hover over the Alliance tab and hover over community groups, you'll see we have 4 community groups in the Local Wellness Alliance, and we have assigned a page for each community group. So I will click on the North Community Group, and in Williamson County, North Williamson County consists of the communities of Lawrence, Georgetown, Gerald, and Lear. And on each of our community groups, we really wanted to spotlight what that geographic region is, as well as what we have concerning each of the zip codes. And so you can see on North Williamson County, we have a dashboard. And throughout our pages, you'll find these dashboards that are useful, hopefully, to you. So, for example, this one has zip code 78626 data, and that specifically is Georgetown. And you can see for 78626 that there needs to be more improvement concerning asthma and diabetes and hypertension when compared to other Texas counties. But in 78626, we are faring better concerning hospitalization rate due to heart failure. And so you'll just find one of these pages for our north, east, south, and west Williamson County. Okay. And going back to our main page, we will hover over the Alliance tab again. And if you go all the way down to our working groups and hover them back, there'll be a drop-down box. And we have, the Alliance has 9 working groups. And these working groups are here to really work on their specific interests, whether or not it's active living, wellness, or health. Working groups will target, will develop action plans to target the top 5 health priorities. And during this site tour, I'm going to specifically focus on mental health, since mental health is our #1 health priority in the county. So hovering over working group, you can click down to the Mental Health Task Force. And that is one of a really cool partner of the Alliance, and they've done a lot of great work in improving mental health in the county. And so you can see this working group page has just a brief description of what the task force is, and it also has one goal that they have developed in their action plan. And all our 9 working groups have developed over the past summer develop goals, objectives, and strategies to targeting the top 5 health priorities identified through our CHOP. And so you can see the goal, and if you scroll down, you'll see these 3 objectives. And these are all actually sandwiches, or they can expand. And so if you click one of the sandwiches, the Access to Care sandwich, and click it, it actually expands. And you can see that we have 7 strategies that the Mental Health Task Force has identified to reaching this objective. And our goal is in the future that all our community members can to really look at what the community is doing to improving mental health per se. And these are the objectives and strategies. And beginning in 2017, we'll begin to monitor whether or not these strategies have not started or in progress or completing. Okay, great. And so now we'll go back. That's just a brief information on our Local Wellness Alliance information on our website. And next we'll be going over our top 5 health priorities in tabs right here. And as many of you know, in June 2016, we identified 5 health priorities through the 2016 Community Health Assessment. And then our #1 health priority is mental health. Our #2 health priority is access to health care. #3 is awareness of health care resources. #4 is active living. And #5 is chronic disease. And also under this goals and similar objectives to targeting these priorities. And so these are just a compilation of, just what our working groups are doing. And we really wanted to highlight that. And so like you saw on the Mental Health Task Force working group page, you can see that there's the Mental Health Task Force sandwiches again and their objectives. And if you scroll down onto the page, you'll see this dashboard again. as well as our infographics that can be of use to you when you are talking about the 5 health priorities in the community. And so I just wanted to highlight a little bit about these dashboards. If you go and click on this blue click to view data, this is just a very small picture of what our data looks like, but if you click this button, it'll actually load this really nice dashboard that Kara had talked about earlier. And we just wanted a really easy way for everyone to access data related to the health priority. So this specifically is the mental health dashboard. And you can see just some of the data that we have. We have an age-adjusted death rate due to Alzheimer's disease, age-adjusted death rate due to suicide, age-adjusted hospitalization rate due to mental health. And as you can see, I just wanted to talk briefly about this indicator. I find this website to be very useful because it really shows you all the data in one easily viewable form, and it's colorful. And for example, the age-adjusted death rate due to Alzheimer's disease, you can see that in the county, 27.1 deaths per 100,000 population. And this number is from 2009 to 2013. And when compared to Texas, we are fairly better. We're in the green section. However, when you look at the Texas value and the U.S. value, there is still improvement to be made in Williamson County, as you can see. However, luckily, compared to the previous value, which was 28 compared to 27.1, we are actually trending downwards, which is a good thing. And so that's just one. We wanted to show you just how useful this is. We're not just looking at data in one time frame, but we're able to compare it to state and to national values, as well as compare it to our previous values. And so you can do that for all our indicators. And we have about 170 health data indicators on this website. Okay, so going back, I just wanted to show you our community health assessment. So if you scroll all the way down to this assessment, it'll pull a drop-down box. And our most recent 2016 health assessment is right here. And so if you click it, there's just a nice of our assessment. As well, if you scroll down on the page, you can download our infographics. And lastly, on this health priorities drop down, if you scroll all the way down to our improvement plan and click the 2017 to 2019 improvement plan, this is the plan that we've been working really hard in our working groups, and through our final step.
Verizon Wireless, the wireless customer is not available at this time. Please try your call again later. Announcement 1, switch 40-4. Welcome to Verizon Wireless. The wireless customer you called is not available. Try your call again later. Announcement 1, switch 40-4.
I apologize, sorry. So we've been working really hard on our 2017-2019 Community Health Improvement Plan, and this actually will be published hopefully in January. And we just wanted this to be a really nice, if you can see our 5 icons, these are the top 5 health priorities identified through our 2016 CHOP, and these are, in our chip, we have created action plans to target each of these health priorities. And so our 2017 to 2019 chip will be up here soon. And we just really thank our partners for helping us with this project. And it really is our goal that the chip is the community's improvement plan. Okay, so now to the data, to the good stuff. If you go to our 3rd tab, Williamson County data, there are over 170 health indicators on this website, and this is a very important feature of this website. We really want everyone to really go to this site to search up data, because we know sometimes it's hard to find data, or it's disparate, or we don't know if we can trust it or interpret it correctly. And so if you click on this All Williamson County Data, it'll bring you to this awesome page. And just a key things to note, there are a couple of buttons you can see. If you click on this All Data button, it'll bring you to our dashboard that contains data for all indicators at all locations. But also we've wanted to separate out by demographics, because we know that our population's aging, but it's also growing really quickly. So you can see any data related to aging, and data related to children, and also data related to disparities by race, ethnicity, age, and gender. And also you can look at indicators by location, as well as indicators specifically related to social and physical determinants of health. Okay, and so I wanted to show you an easy way for anyone to search data. Sometimes looking at this is very complicated, and you might not be able to find the data you need, or you don't know what you're looking for. And so one good way is to click this All Data button and really scroll through the data, but also this feature, they just loaded it. HCI just, this is one of their new features, and so if you click the search bar, you can actually just search right there on that page and get the data you need. And like I mentioned, we wanted to use mental health as an example, and so, for example, if you search up mental health in this search bar, and you click Enter, it will pull up all the indicators that are tagged with mental health. You can see there's the age-adjusted death rate due to suicide, age-adjusted hospitalization rate due to mental health, depression, frequent mental distress. There's a lot of indicators that you can choose. And so once I'm going to choose the age-adjusted hospitalization rate due to mental health. And once you click it, this window will pop up, and it shows a description of what that indicator is, as well as whether or not you can view data by county or by zip code. And so I would choose to click View this data by zip code. I think that's one of the coolest features about this, is you can break down data by zip code and not just look at county level data, which, as we all know, this county is very big, and data on the East Williamson County is not the same as West Williamson County. And so you click zip code, and then this is the indicator page that will load. And you can see here's the description: age-adjusted hospitalization rate due to mental health. You can choose a zip code. You can choose a measurement period as well. And so on the left-hand side, you can see this GIS map, and by zip code, you can see that the western portion of Williamson County has the lighter blue, which means the rates are lower, compared to the eastern portion of Williamson County, where the blue is darker. And it's a great way to visualize how our mental health, how does the mental health landscape look like in regards to hospitalization. As well, on the right-hand side, you can see a bar graph of each zip code and how their hospitalization rate compares to the other portion in the county. And lastly, income, foreclosure risk, homeowner vacancy rate, home ownership. And these are just some of the cool features on the website, on the data. And so, and if you have any questions regarding data, always feel free to contact us and ask us. We're always here to help. Now let's go back to our main splash page, and I wanted to highlight just two more, I think, are really cool features of this website under Tools and Resources. And so if you hover over Tools and Resources and click this first View Community Events Calendar. This is our calendar page where we've displayed any activities of the working groups, community groups, as well as the health district. But we also, so you can see right here on Thursday, November 17th, it shows our webinar, and so anyone can view that. But also, now there's a Submit Event button, this green button, and that's for anyone that would like to submit their events and their activities to their to our website, so that we really want this to be a community calendar. And so if you just fill out this form and submit it, and we'll approve it, and then it'll be posted straight onto our calendar. Another cool feature that maybe many of y'all have heard of, or maybe not, is this Aunt Bertha, Find Resources in Your Zip Code. If you click this, Williamson County has recently partnered with Aunt Bertha to provide this awesome resource where you can actually type your zip code and search low to free cost resources, whether or not it's related to food or housing or money. This is a great way. And so, for example, like in Georgetown, zip code 78626, if you type it in the search bar and click search, it'll actually pull you up to this this Williamson County version of Aunt Bertha. And you can see that there are over 1,000 programs that serve people in 78626. And yes, they might not all be local, but there's also state and national. They sort it by state, national, and local. And this is just a great way to refer other people to it, or you can refer people to certain resources. And so, like I mentioned, there's food and housing and goods, transit, health, money, care, and education. And just to show you, if you hover over this food section, it'll actually drop down to specific types where you can click even further. So whether or not you're looking for the food pantry or emergency food or community gardens, this is just a great resource that we wanted to share with everyone, and we're big champions for this website because it in part came out from the Community Health Improvement Plan. And so that's just a brief tour of the site, and so if you have any questions, I'm just going to give it back to Ray.
Thanks, Melissa, and thanks for really taking some time to give us all of that information and talk about a wealth of information right there. I did want to say, when I go back to Aunt Bertha, we are looking to host a webinar on Aunt Bertha this coming month, December, and I think I'll be able to give you the exact date on that in a second. But we should be able to give you some more information on that. We have a couple of questions. So here's a good question. What are the restrictions on the calendar? So let me say this. We ask that you send us events related to your organization as they fit the criteria for Healthy Williamson County. So if you're hosting an event that's, and it can be something that you're doing to build awareness. It can be also a class or an educational event as well as an activity. Send those things to us, and we'll be able to look at those and give you some feedback. But for the most part, we would like to post as many of those events in our community. Also, we had a question on Aunt Bertha. So let me go back to this question because I think it's an awesome question. If you notice that something is on Aunt Bertha, is there any way to add it? And we do have that process. That's what we're going to do when we have our next webinar on Aunt Bertha. We have a tentative date for December 15th, and that would be a morning webinar, probably starting around 9 o'clock. We'll send that out to all the Alliance members, and then they can share those with others. We have another question. Is the Wilco site live now? Yes, the Healthy Williamson County site is live. And the thing that we think is awesome is that it's ever-changing. Kara, are you still online? Hey, Kara, are you still online?
I am, thank you.
Okay. Hey, Kara, can one of the questions was, is the site live now? Can you just kind of give them a brief, overview as how the site changes through y'all's eyes over there at HCI?
Sure. So the site is live at healthywilliamsoncounty.org. And so what Melissa showed you today were screenshots of the live site. And the Healthy Williamson County team does a great job at always adding to it. So what we do on our end is make sure that the data, we're always looking for new data to add to the site, as well as updating what's already there. We have site and software updates that come out pretty frequently, every couple of weeks, so we're always looking to improve the product, make it easier to find data, make it easier to visualize the data. So every time you come and visit the website, hopefully it looks a little bit different and you can discover something new.
Yeah, and we really can't say enough about how much HCI does to listen to their clients about improvements. And then they also share best practices through regional meetings. We just had one recently in Dallas where we met with other people that are using a similar website so that other health districts and organizations can share best practices. We do have some things coming up on the horizon, ways to post not just our best practices that you can find on this site, and that'll probably be in a future webinar, but also places that we can house videos about either organizations in our health district as well as these webinars. Are there any other questions maybe that you have? Okay, well, I would really want to thank our presenters today, Kara Woodard with HCI, and all the good work that the Healthy Communities Institute is doing for us, and Melissa Tung with Williamson. We do want to thank all the participants. We hope that doing webinars will be a way of enhancing how the WCCHD and the Wilco Wellness Alliance can serve our community to make